Good morning and welcome. My name is Alero Edu and this is Sunrise.
I'm Ayo Makinde. Good morning and welcome.
Welcome back.
Thank you. Hope you were able to hold fort because I wanted to take some notes, by the way. And then your friend gave me this pen. The last time
My friend is feeling very cool this morning.
The last time anyone gave me a pen with his name written in white paper, on a white paper, in the pen was when I was in primary school.
Did you use biros in primary school?
Yes, I did.
Oh.
Thank you very much.
Okay, well, that shows your age. We had to use nib and ink.
I used.
You know what an inkwell is?
That pot, like teapot.
Yeah, teapot that's only about 2 inches diameter.
That thing only reminds me of one thing.
Do you know what a nib is?
Which one? That one that looks like the one that they were made in 1779.
Well, what does it look like?
That they used to write it.
Oh, God, he knows what a nib is.
Put it in. Even if
I'm sure my children don't know what a nib is, or an inkwell,
no, they
or
don't.
blotting paper.
No, ask them if they know what a slate is.
Oh, well,
they'll show you this one.
Yeah, that's it. That's it.
So the last time anyone did this was when I was in primary school. It was secondary school, actually. And he even wrote his name on it. Anthony.
No, don't do that.
Oh, okay. Just want to try. I'm not actually using my glasses.
He actually begged
that
you should not call his name.
He did?
Yes, he did.
I did.
So please do not let the whole world know that he's still writing his name in white paper and sticking in his biro. How much is a biro? 20 naira or something? Maybe 50 naira?
But why do we even know?
Oh, Tony, come on.
How do we even know? Did you mention somebody's name?
You said Tony.
Oh, really? How did
we
even
spare
know
him, don't say his surname.
How did we even know it? Hey, it's his, not his son's.
Well, he gave it to you, so you return it to him, so he can give it back to his son, should it happen to belong to his son.
If it gets home.
Oh, dear. Oh, dear, this pen is in trouble, from what I can see.
And so are many other things, that are, bugging us in the country now. We keep talking about something, Alero. We keep talking about this thing that you have also always, been interested in, and that is compliance with the basic COVID-19 guidelines, especially the non-pharmaceutical guidelines that government has been giving us over and over again. It is actually very, very baffling when you find that people don't even comply with these things. I was, of course, I was out of town last week, and at the airport, you cross the threshold into the airport with your mask. And after that, what happens? Even most of the people who are the people who attend to you to get your booking tickets and all of that, not all of them, not all of them are using their...
Yeah, but did Lagos State not say at some point about 10 days ago or last week that they were going to start enforcing it?
They have started enforcing it.
But there's still lots of people out there without masks.
Then do you want to ask the question? Of course, in the part of the effort of Lagos State government to enforce it was the raiding of that nightclub. Don't gather so many of you into one room at any given point in time. Of course, people did.
And the shutting down of that club where
shutting
that
down of
party
clubs
was held.
Exactly.
Ooh.
And then there was another occasion where some people were lined up at a mobile court, sentenced, and even at that, what has come out of it? Oh, there was also pictures and videos making the rounds of a large gathering of people at a party. What has come out of that one? And then I talked about some government officials here and there. There was also a video that made the rounds. I think it was the last week or week before, that a certain official of government, I think it's an immigration service or something, was harassing a young lady simply because the lady told her, "Wear your mask."
Can you imagine? I think it is time for me to read this advice that came from the United Nations. And I quote, "We're asking everyone to treat the decisions about where they go, what they do, who they meet as life and death decisions, because they are." This is coming from the UN. Where you go, who you meet, those are matters of life and death right now.
What is interesting about what you have said now is that it came from the very top. Dr. Tedros exactly made that statement, and guess when? July last year.
Oh, God.
And we continue to, hold, ourselves, make decisions as if it is nothing. The people, that's the information right there. We're asking, the decision to do this, some people came to my house yesterday, and before they entered, they were just, hello, sir.
Where are your masks?
Who are you? They told me who they were. Where are your masks? In my pocket. Oh, God, do you even believe that this thing exists?
Oh, come on.
I said, okay, tell me, if you say it doesn't exist, what will make 90% of the countries of the world to lock down their countries and say the same thing over and over again if it wasn't real? Okay, fine. You may not believe your own government. Most countries of the world, most citizens don't believe their governments. But why would they lock down governments all over the world?
And like we said last week, the deaths are no longer numbers. In those numbers are people that we actually know. And those that we know in those numbers are actually increasing. And you still think there's no COVID-19? If you don't have to go out, don't go out. When you do go out, wear a mask, social distance, use your sanitizer or wash your hands. Better still, stay home if you can, because this is a matter of life and death.
And then one other thing that should be added to this.
Life is good.
Absolutely. One other thing that needs to be added to this is many people don't know who is going to be susceptible to COVID-19. You don't really, that's the funny, crazy part of this thing. You don't know who is going to die because you don't know if you have any debilitating
Some are
illness.
asymptomatic and yet can still spread it.
Exactly. And the person to whom it is being spread, does the person have diabetes? Many people don't check their health status. Do you have diabetes? Do you have high blood pressure? Do you have hypertension? Do you have any disease that your body is already vulnerable as a result of? So if you don't know, so this is why we all need to take precautions, because it is a matter of life and death. Take that advice of the United Nations.
Well, we'll be talking more about the COVID-19 later in the program, because there is a lot to be said, actually.
Absolutely.
Maybe we should go to the menu now. Or is there
Absolutely.
any other thing? How did the power sector treat you this last week?
Power sector.
Sorry, George.
Power sector. Which one? The energy sector or the power sector? Electricity sector?
Yes, electricity.
They take that light a little more now than before. I think what will be interesting here is for you, the viewer, to tell us, what you think. How has this hit you, directly or personally? That advice of the federal government to reverse the rates, the increase, how has that happened? A question a friend of mine asked. Okay, they increased it in January, right? This same month, and they have been asked to reverse it. Why they increased it and the toll was collected?
No, but they're going to increase it at the end of the month.
No, they won't increase it until after the negotiations with Labour, because that is an integral part of the conversation with Labour. So the money that has been collected, okay?
Would it be refunded?
The menu, please.
Well, I didn't say anything. Yes, so we're going to start with COVID-19. No lockdown again. Nobody wants a lockdown, I promise. I promise. And the only way to prevent that is by adhering to the protocols as prescribed by the NCDC and other health officials. That's the only way.
It's really, really that simple. And still talking about that one, COVID-19, ensuring protection for all. This is about, all of the conversations about the vaccines, local, international. Are we getting them? When are we getting them? How many are we getting? Who are the priority people? All those things. And when is it going to be your turn? You'll find out.
Well, never mind that there's talk about some fake ones lurking around now. But after that, we will look at developments in Ebonyi State.
There's some very interesting developments there. What kind of development? You want to stick around. And our taste of the week this day is a man that made what is called Konkere Fuji popular. Just stick with us.
Yeah. Even the way you said it and the way it is gives you a picture of the
Absolutely.
kind of man that we're going to be having as
And guess what?
and he's just a laugh.
He
He's just a laugh.
he changed his name.
Oh,
What did he change his name to? You know, his name is what his name is.
Yes.
So when he writes his name, he puts a question mark behind it. That's
Oh.
the change.
I see.
Yeah.
So am I who I say I am?
No, no. He said, the name is a statement, right? But when he changed it, he now made it a question. Is it working now? More
So
about
we're
that.
going to be having a very crazy man with us to close today's program, and you will do well to stick with us and have fun with us. So get your coffee or whatever, make yourself comfortable, and be a part of the program.
And if you prefer, get your camera ready with moi.
Coco. Now let's get the show started. The federal government has refuted the news making the round that another lockdown is imminent due to the rise in the cases of coronavirus. During the week, the federal government also announced Monday, January the 18th, which is 2 days' time, as the resumption date for schools in the country after an earlier announcement that the resumption date would be reviewed. The question is, how safe are we with the resurgence of the second wave of the virus? And after that, I put a huge question mark.
Okay.
Now, to look at that with us this morning, it's my pleasure to welcome two gentlemen who are with us in the studio this morning and one who will be joining us via Zoom from London. We have in the studio Mr. Chuks Nwoko, social entrepreneur. Good morning.
Thank you for having me.
We also have the Secretary of the Nigerian Academy of Science, stroke public health physicians, Dr. Doyin Odubanjo. Good morning.
Good morning. Thank you.
And joining us via Zoom is Mr. Annie Bassi Ayo, who's co-founder Axiom Learning Solutions. Good morning, Annie.
Good morning,
to see you again.
Alero. How are you? Thank you, Alero.
Now, let me begin with you, Dr. Odubanjo. In spite of the rising numbers, there hasn't been a lockdown. Why do you think this is so?
Well, let's be a bit gracious to those who have to make these decisions.
Okay.
In understanding that there are no easy answers, to some of the things they have to answer for. We have a pandemic which people are focusing on, which is the virus. But several pandemics come with it. There is the fear, there's social-economic challenges.
Oh, the fear is also a pandemic.
It's a pandemic. People are scared stiff. So there are all kinds of things that it brings along with it, in so much that it makes it a very complex thing to deal with. So when you look at it and you say, oh, yes, we are having this upsurge in cases, I avoid the term second wave. But when you say there's this upsurge in cases, why don't we lock down? The question is, can we afford to lock down, actually? When we did have the first lockdown, we saw what happened even in Lagos. Yeah. We saw how people became scared even in their houses, that they might be invaded. We saw all kinds of things, insecurity, violence, domestic violence on the rise. So there are things that come along with it. So the real question then will be, can you afford it? Can you afford another one? Let me also at this point say that a lockdown is an extreme measure and an unusual measure to use in the control of an epidemic like this. You want to actually control behavior. You want to do other things like being able to diagnose rapidly and being able to treat effectively. A lockdown is an extreme one, which you don't want to use too often or for too long because of the problems that will come along with it.
When you say we have this, when you list the second pandemic as fear,
right,
would you say it is as pervasive as the one that we know, given the fact that people are not complying with the simple protocols that you all have been recommending?
It actually is probably as pervasive, because when you watch what people are doing or are willing to do. You know, how if today, for instance, we tweet right here and we put it out and say, oh, if only you would take 50 tablets of paracetamol, you will never catch COVID-19. You'll be shocked at how many people will take 50 tablets before we're done with this show.
True.
That is fear. That's the power of fear. That's what it makes people do. You know, and globally, if you watch what people are willing to accept, what they are willing to give up, liberties and all of that, it's also fair sometimes when you look at what is going on.
Quick opening, Mr. Nwoko. What do you think of what he said? We have just 30 seconds before we take a break.
It's absolutely correct. I am more interested in the characteristics of what he mentioned, which is fear. You know, it's very destructive. And you know that the economics, the politics, the economy, the destruction that has come with it has also led to fear in the economic sector, business owners, entrepreneurs like us, and in the homes, when you're not able to put food on the table. So the fear in itself, like you mentioned, is major. And that's what precedes every war.
I still have questions about that fear. but I think we should take a break.
After this break. Welcome back. Now, let me go to Mr. Bassi Ayo. Schools are resuming on Monday. What are your thoughts about that? In light of what is going on right now, schools are going to reopen.
Okay. So before I just answer that, I just want to agree with the co-panelists. This is a pandemic, and very often we are looking at just the health issues. You know, we're looking at numbers, we're looking at indices that sort of always look back at health. There is a health issue. And when we say health issue, it's not just the virus itself. There's a mental health issue, which I guess when they mention fear is also surmised within that. Then we have a learning crisis, and I think that's what you just alluded to in your question, which I'm going to address. And lastly, we have an economic issue. We cannot discuss learning on its own, neither can we discuss economic or health on its own. We need to look at it as an interplay of factors. Schools are opening on Monday, and I must commend the federal government and various state governments on their efforts in trying to surmount the issue. However, we are not yet there. The PTF has done a lot of work, but we're still not there. And when you look at some of the protocols that have been outlined, you ask yourself that are these protocols affordable and available in a rural, a low income, and a poorer neighborhood schools? They simply are not there. How many schools have a health facility? How many schools a functional health facility? How many schools have trained personnel? How many children in low neighborhoods even have access to clean water to have their bath, first of all, talk less of constantly washing their hands in schools? So I think the answer is that we do have a learning crisis, and it's where we are, it's a reality. And learning is not just about education in classrooms. Learning goes far beyond the classroom. The whole learning ecosystem involves assessment, involves learning, and certain other things. I think what is very important at this point is that when we say schools should resume on Monday, we should also sort of provide caveats that where schools are unable, where community, state government, local government are unable to open schools on certain days, what are the alternatives that you provide? We said a lot about online learning, which is fantastic, but the question is how many people have access to online learning? So I think, yes, schools have opened, and if you look at even the private schools, everybody's not going back to school because it's clear that the guideline says we should, schools must not operate at full capacity. Now, I want to look at the government schools, for instance. If you had a class of 70 people, you already had an overcrowded classroom, which we know in many instances is a reality of the day. We're not just talking about Lagos, we're talking about an entire country of roughly over 100 and something million people. So do we have the capacity to say we will send 2 teachers to teach under the 3 climatic conditions? Do we even have enough teaching personnel? So I think we need to really understand that we cannot take a one-size approach. We need to embed and strengthen our school systems. That's the teachers, the leadership, the commissioners, the school heads, so that they can have a varied approach. Online learning must continue on TV and radio to support whatever learning will be able to occur in the classrooms. But coming back to the health issue, UNICEF just said that children are not drivers of the virus. I beg to differ. I'm not a scientist. I beg to differ in the sense that there has been so much research on the health impacts of the pandemic that we are not really sure where things stand, and things have not been fully verified. The WHO and authorities would say one thing, and months later they change. So we are in a place where we cannot go by what is issued. We must develop sustainable local solutions. So in a place like Lagos State, a school in Ekwe may decide to do it differently. They may decide that they have 2 schools a day, morning and afternoon shift. We need to also build capacity for the parents so that they can take, sort of conduct some learning at home with their children. I'm not talking really about the middle to upper class children because they have access. I'm really talking about the lower income children because they are the ones that we're likely to leave behind. Now, when you said schools open, I just wanted to bring somebody else to the equation, the NYC camps, which I just read Punch this morning, that they've been redirected to start orientation. I think that is quite a cause of concern because we need to reduce the gathering. The gathering is what really we need to reduce. I mean, we need to resume some sort of normal life, but we must ensure we don't gather. I listened to what the panelists said. How many people in Nigeria? I mean, I just left out a few days ago. How many people are actually observing the protocols? How much more children? How much more young adults? So I think we need to face reality.
I think that's where the issue really is, why a good number of people are actually quite concerned. But let me bring that conversation back into the studio. Mr. Nwoko, you began by, talking the other time about this, the fear angle, the fear ambit, and he has also mentioned that, if we look at the mental health aspect, it is quite significant. But, looking at the social, the entrepreneurial aspect of it, a very good number of schools are private schools. Mm-hmm. A significant number of those schools have had very limited capacity before the pandemic. Mm-hmm. And now we are returning to school. What are your fears, if I can go back there, and what do you think we should be doing? Because it is also part of the responsibility of government to compel the schools to enforce the observation of those protocols.
I think at the point where we are, it will not be proper for me to use the word compel. I think that government should be able to reach out to its citizens by saying something like, look, do what you need to do to protect yourself. Do what you need to do to stay alive. Because as an entrepreneur, and coming to this place this morning, as I was coming, the question that was on top of my mind was, what is it that is really killing people? Because people are dying. What is it that what we don't know is killing us? We know about COVID. So when we opened this discussion, the first thing you mentioned was fear. And I have always talked about fear in my articles and all the things, other places I've spoken at. I've talked about fear. Now, as an adult and as a family man, I have developed my own local system of dealing with fear. But for the purpose of this discussion and for people who are listening to us, is it that beyond COVID, is it fear that is killing us and all that? Capacity, yes. If school is opening on Monday, how is government helping? I believe that government can help by just mere speaking. Like I've seen other heads of government speak to the people. Words of encouragement. Professionals like this seek their opinion, see what you can get, because there are just so many opinions. So I'm concerned, there's so many views, many opinions and all that. And as far as I'm concerned, in the month of December, I almost died of fear. I almost died of fear, and as a result, I had this contraction. In fact, I forgot it in the car. I brought what was used for me in the clinic, where I had a contraction of the heart. I stopped breathing. I used bitter, I used everything in wanting to start. Like when I couldn't deal with it anymore, I was taken to the hospital. Now, I spent about 6-7 hours, then came back home. How many people were that fortunate? Now, I think that we need government, not just in providing money or in receiving money, but what are you saying to the population? You got to constantly speak to us, because right here we are speaking. And maybe somebody can pick up one thing here and be able to get out of an ugly situation. But it's government's duty to constantly speak to us. Maybe say something like, do what you need to start, like open your schools, because this disruption, if we do not take care, is going to ruin our economy. That's if our economy is not already ruined. It's going to ruin our economy. It's going to disrupt the education of our children, like the man who spoke to us from London. The politics is going to be ruined. So if you do not have that leadership come to us by constantly speaking to us, either in the mornings or in the evenings, saying something to encourage the population, we are not going to make headway. We'll just be all talk.
During the break, we were talking about masks. Masks seem pretty basic. And if I remember correctly, I think it was Cross River State government that opened a mask factory. If government were to give people masks, do you think they will not wear them? Because like you say, one cloth mask is about 400-500 naira. Some sell for as much as 2,000 naira. Absolutely. And the disposable ones are about 100 naira each. But you're not going to advise the man who is selling meat in the market to use 100 naira use, and by the end of the day, he throws it in the trash.
Or in about 2 or 3 hours.
So if masks were supplied, do you think people would behave better and actually use them?
Okay, so I think you've touched on the key issue, which is what we need is to have behavioral change, in general. Wearing a mask is not normal. It's not a natural way of life.
True.
Me walking in here and not shaking your hands is not normal. Not walking in there and hugging everybody I see is not normal, and trying to keep away from you. That's not normal life. So we're asking people to behave abnormally, so to speak. And the only way they can do that, and I think like Mr. Bassi was also saying earlier, the only way you can do that, get the sustainable change, is information, which is what he was just saying now. Yeah, is information. You need to talk to people, and you need to do it repeatedly. Now, you say, well, that is happening. No, it's not happening. What we have tried to use largely, I think, has been a lot more of fear and a lot more of fiat. We give orders. We will threaten you. We will, tell you will die. And as he spoke just now, what I was thinking about is the term for that in my mind is what you call positive reinforcement. You need to come to people's sides and talk to them. Explain things to them. This is what is going on. This is how this thing works. This is how this is transmitted. And now we want to ask you. So if you now bring the mask, for instance, I fully understand. It's a lot of work. It's by no means an easy task. And while we sit here on Sunrise, we're talking to just a small percentage of people, not to run down Sunrise, but there are a lot of people who are already by the roadside selling stuff. They're not watching us and all of that. So this is a lot of engagement that needs to be done, that you need to get down and engage with the people, explain to them. Actually, it comes to my mind, also just as he was speaking, that as of April, thereabout, when we were just about to go into a lockdown, and the state government was beginning to shut down things, they want to shut down the market, they want to shut down the churches. The notices that were coming out actually had the voices of the leadership of those groups. So they talk about the market women's leader has met with the government and has therefore passed on a message to all the market women and all of that. And then somewhere along the line, that got lost. And all we were hearing was from the government, not from the leadership of those people.
Leaders.
Yes, so that you take the engagement deep down, sit with the people and say, look, we know you need to make money.
So we have dropped the ball at that point.
I believe so.
Because you would know that, the conversation both of the president and of the PTF COVID-19, of the vice president and several others is, for the governors at the state levels to take the message of these protocols we're talking about to the locals, the local government levels, the traditional rulers, the community leaders, the sectional leaders you're talking about now, the market women, the bus drivers, Okada riders, and the rest of them. So that was the advice. Perhaps that's when that happened. They were able to take it to that point. At what point do you think we lost it? And what are the consequences if we do not get back there?
The consequences are that, in Chinua Achebe's words, things fall apart. We must get back there, really. We have no choice. We must get back to where we sit with the different groups and we talk to them. We don't threaten them. We talk to them. We ask even their own advice that how can we sustain, life, as it were, in the midst of this challenge. Okay, you want to do your business, you want to do whatever, but this is the challenge. So how can you help us?
Okay.
What would you suggest?
Yeah, Mr. Bassi, it is tough getting this conversation to the adults, the parents, the guardians. How do we advise children whose parents and guardians find it difficult lining up with these simple mechanisms? How do we get those children who are returning to school to line up when the elders are finding it difficult?
Yeah. Thank you so much I think we've set the scene for what the issues are. And we have an opportunity here. And I'm happy that we all on this program are speaking with the same voice. The issue here is communication and engagement. Engagement needs to be participatory. It needs to have a feedback mechanism, understanding why people are not doing things, not just the sciences driving why people are not doing things. Now, communication must be targeted. And as I said earlier, it must not just talk about the health issue. It must be interwoven, health, economic, and learning. So for children of various ages, children that are, or would I say young adults who are at the transition class levels, you would want to craft a message that, look, it is important that you adhere to protocols because you need to transit onto university or your vocational center in 6 months. And if you don't adhere, you could fall sick, you could A, B, C, D, F, G, Y. For children at early learning, you turn it into music, into dance, into folklore. And a lot of the communication I have been hearing is in a lot of scientific and big man's English. We're not speaking pidgin that the market woman can talk to her son or daughter. So whether a child is in a top school, international school in Lagos, or in a rural school, we start having disparate communication channels so that something is in Fulfude, is in Efik, is in Nupe, is in Yoruba, that it reaches the grassroots. And these are not necessary long things. It could just be a mantra. A mantra could be, like wash your hand bin, sneeze bin, something of that nature. And it's not complicated. We have communication experts in this country. We have content people. This can be done. So the answer to your question is that we cannot continue with a universal communication approach. Communication must be targeted to the various sectors, to learning, to health, to the economy. Communication must be interwoven. It must address issues at the mother tongue. It must address issues at, sectoral, both informal and formal, because the issues are dissimilar. I just want to paint a picture to you. A parent in a highbrow school in VI, in Asokoro or Ikoyi, is more educated, has a different nuance to the understanding, and can say, okay, you know what, my child, I want you to go online because of this. So the approach to that parent and the communication material would be totally different from the woman who has to drop her child or whose child is going to school in the neighborhood, walking to school while she goes to the market. So we need to communicate. And like the gentleman has said, we shouldn't use fear and propaganda. We need to reassure people. And with the reassurance is where leadership comes in. And I believe that's what the PTF is asking state governors to constantly disseminate. And I think some state governments have done a fantastic job. I don't want to call out names, but some have shown leadership. We need to then ensure that that leadership comes to the household level. Because as we've said, we need to realize that we're in a psychological war situation. This is no longer normal. You know, it's really a constant daily battle, and we need to empower people by giving them the right tools of communication, and empowering them by engaging them, whether it's at the school level through PTAs, through SUBEB, sending jingles on radios, social media, TVs. That can be done. I've not seen anything that is addressing children on a pluralistic level till now. So we should use dance, poems, music, and simple mantras to drive the message to the younger groups, while a more salient message can be given to those at say SS3, SS2 who are in the examination classes. Thank you.
Now, Chooks, you are a parent. So how confident are you that your kids will be safe when they return to school on Monday? And how confident do you think other parents are, and will they be ready to send their children off to school on Monday?
Thank you. My child, who is built to return to school, to the university, my last child, is watching this program. I have had a traumatic experience just finishing from SS3. They back and forth. She went back to school. They asked them to go home. Eventually, they went back to school, wrote WIEC, right? So, and as I was coming here this morning, we talked about her to watch. Now, what time she's going back to school also is important, because those that are already enrolled, I don't know when they are going to go back to class, take their lectures, write exam, pass, so that these new ones can enter. But she knows what to do. She knows what to do. She knows how important the protocols are. We just added something in my house recently where you have to put shea butter and mentholatum in the hot water and inhale it, because both of us have to go out every morning to go and look for something to eat, because she's free now.
The hustle.
The hustle. Every morning we'll go out, so we do that. I was not able to do that this morning before I came out. Now, she has to go to school. But above all, it's a faith thing. It's a faith thing as a parent. You have to have some level of faith that she will go and come back. Because really, this last section in SS3, it was basically faith. Taking her back to school, and the school setting up the protocols when Lagos State government said schools should resume. And she went back to school, and she's back, and she's well. So it is the same thing. But any one of us here that is a parent, you know that really what you owe that child is to have faith that it is going to be well with her. Because you're not going to keep her in the house for a whole year.
Yeah.
And trust that other parents who are also sending their children to school will do the same thing. And that she will be so, with the self-discipline that she has from home, that she'll be able to use that to protect herself. Otherwise, she will just come back home. She knows what to do.
When we come back from this break, Dr. Do, you tell us your experience and what you're going to do with your children after this break.
Thank you for staying with us. Well, Dr. Odubanjo, the question she posted to you before we went to break. Would you agree with, Mr. Nwoko, that the thing to do is what?
Follow the protocols, display self-discipline, because we talked about homes and education at home. You got to do your job.
And so then leave the rest to God.
Well, and expect that other parents have done their
own bit. Okay.
Yeah. Because it's her job to say no. The other parents haven't done their job, or these children do not
Because
have
children actually have that thing. They will say, well, Mom, you are not supposed to do that because my teacher said.
My teacher said.
Yes.
Okay.
If other students do not show that self-discipline that she has, then it's her job to come back and tell me, and I will take it from there. But majorly, my job is to constantly pray for her.
Okay. Yeah, I mean, I can't agree with him more. It's difficult, and it's difficult for parents. Interestingly, I got a message, and my child's school said, my daughter's school said, they can do online or they go to school, boarding school. So I said, forget online, you are going to school. I said, because I want my life back.
Self-interest.
Yes, I mean, you guys I have to be assistant teacher, monitor this, monitor that. I said, no, you go. So that's also is some degree of faith. Faith in the other parents. I haven't taught the children, because every time they go out with me, the first thing I ask them, you jump in the car, is where's your mask?
Where's your mask?
I mean, you're not going to wear it with me in the car, but where's your mask? Because we might stop somewhere or the other, and you're going to have to wear it to get into any place with me. So I expect that people have been doing that. I expect the schools have tried their best. But again, there's always a degree of risk, and that's where the faith comes in.
Mr. Okay, forgive me if you don't.
Yes, you go ahead.
Mr. Bassi, children have been home for a while. So going back to school is like starting afresh. Many of them haven't picked on their books in like how many months now? And they're going to go back into class and pretty much start afresh. What are the things that you think teachers, parents, government ought to look out for in the psychology of learning?
Okay. So what you stated is not the general reality. Like I said, there's a divide. What the learning crisis has showed, a great digital divide. So children from middle to upper class homes actually have not been left behind. They've actually been on top of their classrooms because of their schoolwork, because they have been connected digitally, and online learning has continued. And what we've seen is that online learning is not necessarily dissimilar in terms of learning outcomes. So the children from poorer backgrounds who were not able to catch on because they've not been able to connect to learning online and remotely are the ones who've suffered and have not been able to get that content. But on a whole, both children, irrespective of what backgrounds you're from, would suffer from that lack of social interaction. Children are encouraged, part of one of the basics of early childhood is to allow children to interact. And that interaction does a lot of things. It builds up the cognitive skills, communication, particularly for the younger ones between the ages 3 to 6, 7. That really helps at that stage. For those also going through hormonal things like puberty, you find that interactions help them to kind of reinforce and find their identity beyond working with adults and siblings at home. So for teachers, one of the things we have done for those companies and other, governments and consultants that run a massive program of teacher training is to build the competencies of teachers to be more empathic, to bring in that empathy into the classroom, for the teachers to be emotionally intelligent, raise their EQ so that they know and are more aware. So while you find a child who's not doing as well as maybe he was doing last year, or a child who has suffered, a lot of people have suffered some sort of loss, whether loss of income, parents have lost their jobs, household incomes have gone down, and this has impacted them. So for teachers, it's important that you understand this. And the teacher himself or herself needs to be emotionally intelligent because they themselves have their own issues. So it's almost like we're dumping everything on this poor teacher in the classroom to solve the problem. But governments, parent-teachers association, old alumni of school, we need to build up the teachers to give them a voice of empowerment and the competencies that they cannot just focus on the subject areas, but also on the empathic areas. Now, the other thing I feel where government can really help, and I think this is where data is important. I think that we have an opportunity in this crisis to use data, big data. We call it small big data. That's big data in smaller tranches and targeted. We should see where the curve is showing. I mean, the learning curve is showing a lack of sufficient resource to support learning. Is it in mathematics? Is it in science? And those are programs that we could have remedial programs on TV. Whether it's Lagos State government that is doing a remedial program, it's on TV. You can access it in Cross River or in Borno State. So another thing is I find that all the state governments sometimes are trying to do the same thing. Perhaps with the National Council of Education, we can say, okay, if Lagos State are going to sponsor a program on STEM, let Edo State sponsor a program on arts and culture. Put this program on national network and radio network, and then people can access it globally. The other thing I feel we should really do, and this is really addressed at the Minister of ICT, who's a very progressive gentleman, is we need zero rating for tertiary so that we can really have affordable e-learning and for low income. So people who are accessing any form of learning, maybe over the next 6 months, can be supported at home. So you find that at the lower end, people can't afford data. Can we make that free, that people can get data, can just have access zero rated bandwidth to access learning? So those are practical solutions that can help us succumb this issue for the returning students, both by the teacher in the classroom, by the government, and the stakeholders. Stakeholders, you have a role to play. PTAs, it's not just about school fees. You need to be part of the enforcing of these protocols. PTA association, community-based neighborhood watch association. We need to be a brother's keeper. Particularly, sorry, I keep saying about low-income households, because these are where we are seeing a lot of issues. Are you looking after your neighbor? That child coming back from school, that is coming back later than normal. Have you found out what is going on? We are seeing a lot of suicide, depression. This is a mental health. So teachers, stakeholders, you need to watch out for other things. It's not just about the academic performance. You need to look into the child. You need to look into that teenager and that young adult to see that have they changed. And there needs to be more communication in classroom, not just what do you understand. Let's get to the bottom of how do you feel, and kind of drive that through. And again, stakeholders, mosque, religious groups, mosque, Christian groups, we should do this as much as possible through our Sunday school, through our young people's network. We should really, really try to work this through and not leave everything for government and the teachers in the classroom to observe.
Yes, Annie, I hear you, and I hear you very clearly. But it's one thing to have internet access, but you also require an equipment into which you are going to input that internet access. So in the rural areas, how are they going to get computers? And even in the urban centers, there are public schools, there are more public schools than there are private. How are they going to get tablets or computers into which you're going to feed them this free internet access?
Okay, so Alera, fantastic question. There are many ways to support online learning, but I'll start with what I shared earlier. We can use WhatsApp to teach it. We're using it in Nigeria. We're using it in parts of India and in parts of the emerging world. We're using WhatsApp to teach for feedback and homework and peer-to-peer learning. It's working very well. But what you find, and most Nigerians typically, let's be honest, a large percentage of people, growing numbers, have second-hand smartphones, but they don't have access to continuous data. So they use data quick on Facebook, it's gone. So that's where we need to, that zero-rated could help out. Now, when you mentioned the rural areas, I want to say something about radio. Radio is very efficient. It works well. In northern Nigeria, every single household has an access to a transmitter radio. It works fantastically well in rural areas, and the communication is effective. So FRCN can be deployed. And lastly, I think this is something the PTF should really address. PTF should start looking at technology solutions. We are so focused on the problem that we're losing the opportunities here. Can we have solutions from entrepreneurs, social entrepreneurs, individuals? Let's even create a portal and get people to bring their ideas forward, ideas of how to surmount issues in employment, healthcare. And, those are areas where the government can easily scale up. I just want to throw a very controversial conversation here. When we talk about vaccination, and I looked at the amount of money going to spend on vaccination, I found it boggling. You know why? Because till now, we don't even know if the vaccination is foolproof. So why would we spend huge amounts of money to vaccinate when we don't even know if they need a top-up vaccination in a year's time? Surely 500 billion, 400 billion, 300 billion, because we looked at it at about $8 per vaccine, and about 200 million Nigerians, which has never been contested or proven. If we spend that money in our healthcare, primary healthcare, trust me, things will change. If we even push a bit of that money into little things, rather than putting funds to vaccinate people where we are not sure, people that we're even vaccinating, we are told that after vaccination, you still need to wear a mask to school, you still need to adhere to all this social distancing and protocol. So those funds, I don't think we should even be talking about vaccination. We should divert those funds to things like targeted communication. Empower every single Nigerian, whether you're going to school, you need to get a job, to make a decision for yourself at the household level. And then to give you basic tools. We know there's no money in the world. We know that Nigeria doesn't have money at the federal level, at state level. So let's be real and practical, and let's be more efficient on how we throw money at problems. So in a nutshell, Alero, we can use zero rating in a plethora of ways. Zero rating for those who have WhatsApp, Facebook, a lot of Nigerians on Facebook. And then the radio can support what we call instructional radio instruction. When the lessons are done, even the parents who may not be very literate can therefore assist their children in homework. We can also encourage smaller neighborhood group after school clubs, 5, 6 people, because these children anyway are playing together, to learn. And in all of this, we keep reinforcing, wear your mask. We put the song when it comes to maybe a commercial break.
And sorry to interrupt you. Sorry to interrupt you. You keep talking about WhatsApp. To be able to use WhatsApp, you need at least an Android phone. No. The data is coming for free. That's what he's suggesting. But you need the Android phone to be able to use the data. An Android phone doesn't come cheap.
And I actually was in an office where someone wanted to give the person a number and say, look, do you have your phone? Let me give you my number. And the man says, oh, no, I don't have any phone again. All my phones are with my children. They're using that to learn. And it struck me. This was a middle-class person. And it struck me how difficult it was for him to get even his children to do the online learning. But I think that's why he's talking about, this has to be mixed methods, radio, and all that. Everything has to come together.
Yeah.
There's something else that Mr. Basia, you mentioned, which is, square your purview, Dr. Kubanjo, and that is the mental health aspect.
Right.
I had a shocking revelation, I think about going to 2 years now, where we had a guest who said that mental illness starts from as young as sometimes 10 years old.
Even younger.
And what was the disease? It said depression. 10 years old.
What is depressing a 10-year-old who has no bills
exactly
to
my
pay?
question.
Environment.
My question.
What is depressing a 10-year-old, please?
Even you're depriving them of TV time could be depressing. But the point is to note.
But so now that is out there.
Right.
So clearly, and that's what I was trying to reference in the question, posted to Mr. Basia the other time. These children are literally in a mental health state now. Because they have been denied the access of social inclusion that he referenced earlier. Right. Now, transiting them from that state of mind to the learning environment, to the learning mode now, that's the thing that I think we should be paying attention to now. Do you see us, even factoring that into this announcement of returning them to school?
Well, not enough, but I think he addressed that very nicely, which is that you need the teachers to be on board, where emotional intelligence is concerned.
That is, if the teacher himself is not depressed.
Yes, and even the parents, because like we say, okay, what depresses such a child? I'm sure we've heard a child or two before tell you, I don't think my parents love me. And they meant
it. Children go through that phase where they believe their parents don't love them because they're being disciplined and they think the discipline is too much.
I agree, but the error is to dismiss it completely without actually weighing it, looking at it a little bit, thinking about it a bit more, and sometimes interrogating the child. If you dismiss it completely and don't, you'll get over it, that would be the error. Because not every child gets over it. Some build upon it and actually have been known to commit suicide.
So what does a parent then do?
You have to take the time to understand, okay, what is the problem? Why would you think I don't love you? It takes a bit of time. Oh, yeah, you beat me all the time. You are too. And mind you, that will happen perhaps even more now. Because when they're at home, the parent also is stressed. He's thinking about income and blah, blah. So you get edgy. And sometimes you might take it out on the child. And the child is feeling that, that stress, that anger, and is wondering, Am I COVID? Am I the virus?
Now, Mr. Awoko, I was just going to ask you the question about the parental angle of that conversation. The parent is already having pressure. Please, irrespective of what the social position of the parent in the society, every level of life, at every level of life, we have different challenges that we have to contend with, and all of that. So, in this space that we're talking about now, the parent is also having something that he or she is dealing with, and has to factor in, pretty much step your own case down to address that of this child, while you are thinking about the economic challenges, the delicate balance of life and livelihood, which may or may not have been lost. How do we go about this?
It's very interesting. Something happened yesterday, and this morning I took it to another level. I went to YouTube and I played this song while we were having a quiet time this morning. And I played the song, Let There Be Love. Let there be love
shared among us.
Let there be love shared among us. Very, very important. I've been talking about love, between me and my kids. Because of little things. In health issues, when you get to a certain age or a certain level in your life, you're concerned about your health. So you're seeing your doctor, you're taking care of this, you're taking care of that. One of the things we have overlooked over the years is the environment. I just realized yesterday, we were in a hurry to get out yesterday, so we didn't really dwell on it so much. But this morning I played that song because you needed to just create an environment of love. When I used to go to Pentecostal fellowship or whatever, that was when I used to hear. Yesterday, it just came back to me that we need to just share, we actually needed to tell each other that I love you. Say it back to me and all that. That's what I have done. And I think that if you have done everything well in your own house, check the environment where you're doing this thing that we're talking about. You need to create a conducive environment where love is expressed, where forgiveness is key, where eating together, putting it table and putting the food there and eating together is very, very important. Because like I said, if I was a political leader here, what I would say to my people every morning and every evening is do whatever you can. For me, I'm trying to do whatever I can. And I think that's the level of leadership that I'm able to provide. I don't know the one that you're able to provide. But we were talking earlier, and I said to you what you've done to the people who came to your door was leadership. Even if it were just one person, when you challenge them and question them about their mask. Now, you know that in the streets, people don't believe in this thing. So we provide the leadership. It doesn't matter how they feel and all that. A lot of people, a lot of my neighbors in the street, they tell me when I wear my mask and I'm saying hello to them, say, why are you greeting us with your face covered? Are you carrying this thing? But it's our duty to provide that environment also. So it's very, very important that we create a conducive environment, having done all that we have been told to do. Wash your hands. By the way, I always say this, in 2003, when SARS broke out in Hong Kong and in China, all they did was just follow the protocol. So people ask and say, oh, they recovered quickly. No, they worked on the experience of 2003.
But in agreement with what you said, these are trying times for everybody.
Absolutely.
And we always have said on this program, because you can't go visiting people, it doesn't mean you should forget about them. Reach out to someone, call someone. How are you doing? How's your family? That may be the highlight of their day because they've had a very bad day coping with children who haven't gone to school, giving them stress in the house, and you will just be some bright light in their day just by saying, how are you all doing? So just your family alone, Chooks, is not enough.
I
reach out to somebody else and make their day.
Absolutely.
Thank you very much, gentlemen. Starting with Mr. Annie Bassi-Eyo, who's co-founder Axiom Learning Solutions, who joined us via Zoom from London. Thank you. And we had in the studio Mr. Chooks Nwoko, social entrepreneur, as well as Dr. Doyin Odubanjo, Executive Secretary of the Nigerian Academy of Science, He's also a public health physician. Thank you all
Thank you
very
very
much for
much.
coming to
Thank
share
you.
your
Thank
thoughts
you
with
for
us this
having us.
morning.
Absolutely.
Sunrise will return in just a moment, and we shall be still talking about COVID.
There's the place of prayer and there's the place of work, what you also have to do. And I think we have significantly covered that in the first segment. So there are things that for the kids to do, and there are things for the parents to do. However, there is something for government as well to do. So as Nigerians anticipate the procurement of COVID-19 vaccines, the Director General of the National Agency for Food and Drug Administration and Control has warned against the circulation of fake coronavirus vaccines in the country. Some people say they even saw videos.
Trust Nigerians. Very resourceful people.
Do you have a factory somewhere?
No, I don't have a factory, but I'm just praying that, we learn to put this resourcefulness into more positive things.
And perhaps, okay, well, anyway, let's get into this conversation. It's very interesting, the angle you're coming from, Alera. Well, joining us this morning for this conversation is the Director General of NAFDAC, Professor Moji Adeyeye. She joins us virtually from Lagos here, as well as Dr. Basi Oposen, who is the Director, Disease Control and Immunization of the Nigeria Primary Health Center. Thank you very much for being a part of this conversation, Doctor. But let me start with Professor Adeyeye. Well, when all of this began, we've had, you would remember, we had a good number of conversations. And one of those times, you said our low-hanging fruits was herbs. If we're going to look at some local solutions, herbs and stuff like that, those were the what you call the low-hanging fruits at the time. And you even said that there were options then, there were efforts being made to develop some local solutions back at the time. I think it was about February, March, April, or thereabout last year. How far with that?
Good morning. It's good to be here with you. Last year, 2020, is a year that all of us will never forget. Concerning herbal medicines, it is very true that it is a low-hanging fruit. And NAFDAC started an initiative 2019 March. We inaugurated the Herbal Medicine Product Committee that is made up of researchers and herbal practitioners. And I knew that if there is no link, if there is no bridging of the two entities, herbal medicine will not move forward in Nigeria. So that was the purpose of creating the Herbal Medicine Product Committee. And a lot has happened since that time. COVID, of course, came. So we went virtual. We've had a series of meetings. But what I needed to do with the two bodies, the researchers and the practitioners, is to create trust. The practitioners do not have, or did not, things have improved, did not have trust with the researchers, that sometimes they would just walk away with their data. So we started in NAFDAC educating the two groups on intellectual property or respect for information. Respect for information or making it confidential. So we went through that. We invited the trademark office. We invited the patent office, NOTAB, to come and talk with the two bodies. After that, we invited patent attorneys for webinars. And both the practitioners and the researchers became more familiar with information, protection of information, intellectual property. So that training had to take place. And we've encouraged them, meaning NAFDAC has encouraged them to submit their applications. NAFDAC also made it a little simpler to follow or to follow our guidelines or guidance. We put a lot of guidance on our web on how to register a product, what if you want to do clinical trial, what to do. So that helped a lot. And also the content of the application for herbal medicines. Because we don't want to stay where we were before. We wanted to add science to whatever was happening. So we have many products now that have been submitted or applications that have been submitted. Some have been given approval for listing, some given compliance directives for some corrections, some are waiting inspections because we want to be sure that the herbal environments where they are making the medicines is conducive for good hygiene and whatnot. So a lot has taken place since March last year.
Yeah, Prof, when you talk about herbs, I believe that one can also put vegetables in this category. And there's this post going around that crane has flavonoids that aid the absorption of zinc in the body. Zinc can enter the virus-infected cells and stop coronavirus from reproducing. Is there any truth in that? Any merit?
Yes, actually we take for granted vegetables or plants that God has surrounded us with. Many of the plants have flavonoids, antioxidants, trace minerals good for the body. We take too much for granted and we assume that they just food, you know. I come from a small town in Osun where we eat breadfruit. Breadfruit is a fruit, but we use it to pound as yam. We pound it as for pounded yam, you know, but it's breadfruit. There have been reports that many people in our hometown don't have diabetes. I've not looked into that research, but it's possible that there is some anti-diabetic, content in that breadfruit. The same thing with pawpaw. Pawpaw has some anti-sickling properties, especially ripe pawpaw. So these are things that we take for granted or we don't know. Sometimes we cook our vegetables, we kill what God has already put in it by over-steaming it and whatnot. So there are many things that are natural that if we eat right, they can actually improve our health. So you are right with some zinc, getting into the cells, helping with antiviral, whatever, or cutting down the viral replication and so on. So there is a lot there, in terms of literature. We just need to pay more attention to them. Thank you.
Oh, by the way, the post said crane, but we all know it in this part of the world as ewedu, ordinary ewedu. Please eat plenty of ewedu.
Yes. Well, I'm a foodie. I'm a foodie because I believe in natural things, and I was raised up with herbs.
Just one moment. Just one moment, Prof. It's actually one question that I wanted to ask you before we go to Dr. Bassi in Abuja. Why is it that, most of the time we hear what you have just said now of some herbal, some content, some mineral content, some creative contents in some of our vegetables in Africa that aid certain things, aid healing and stuff like that. How come it would seem like we don't talk much about them? How come? Is it a challenge of the scientific data against the realities of people are going through, of what people are going through, what people are experiencing? From what you have just said, is that a challenge we have here? Scientific data versus reality or experience?
It is science, and that is the reason for forming this herbal medicine product committee. because the herbalist knows a lot about how the herbal medicines work. They don't know how to make sure that the dosing, the toxicology effect and whatnot, how to put all those together for safety. The researchers know how to do the safety studies and whatnot, but the two weren't coming together. And that is why we started the Herbal Medicine Product Committee. Now what we have done is to pair them together. NAFDAC created a confidentiality agreement for them to sign. They said that NAFDAC should witness the signing. So we paired herbalists and researchers together. And as we speak, they've submitted applications, research, proposals together to develop products. So the herbalist now bringing his own knowledge and the researcher bringing his own scientific background. So we are going somewhere. And I believe that in 2-3 years, you will see products, herbal medicinal products being developed together between, with the herbalist and the practitioners collaboration. So
right.
it is because of research. Yeah, thank you.
Well, just to be clear, when you hear herbalist, some people have in mind that it's just one rookie somewhere. It's just people who deal in herbs. You can check up that word yourself. But let's go to Dr. Okpoze in Abuja. Doctor, what's been your experience, as Director of Disease Control and Immunization of the National Primary Healthcare Development Agency? Going around talking to people, because that definitely is a much talked about subject right now. People being willing to take some form of immunization or the other, especially now that we're talking about vaccines for COVID-19. Has that conversation begun? First of all, what's been your experience and what are the challenges we are likely to face at this time on this matter?
Okay. Good morning, Nigerians. The subject matter, as you're saying, is the one that is really now trending in most of our media space. For me, my first experience and joy is the team I'm working with. At the national level, we have the technical working group to introduce the COVID-19 vaccine. And that technical working group is chaired by the Executive Director, Dr. Faisal. And then we have all our partners, NAFDAC, the DG is here with us. I want to appreciate the contribution from NAFDAC to the team, NCDC, all our global developmental partners and donors, CSOs, professional bodies, they are members of the team. And the team meets on a daily basis. That is one aspect. The joy I have and the experience, like you asked, is working with these great men and women, because on a daily basis, the discussions that comes up from the meetings and the responsibilities reassures me that Nigerians are in safe hands. Aside the technical working group,
just one moment.
Strategic team.
Just one moment, Dr. Okpoze. Granted, you have a fantastic team working with you, but the question is actually, what's been your experience on the field? How do people receive the communication that you send to them? What's the nature of your interface with the people at the various levels of life in Nigeria, the urban center, the rural areas, the suburban centers? What's been your experience, and what are the likely challenges when it comes to giving people COVID-19 vaccines?
Okay. For that, on the risk communication, we have a fantastic team that is also leading that, which we support that team working with them. We have had interface with the health educators from all the states. We've had interface with medical association leads. We've had interface with journalists. Yesterday we had interface with religious leaders and so many other teams that we meet, like you've said. And with the radio stations, we also had live radio programs. The things that comes up from these interactions is the fact that there are a lot of negative information in the space there that people ask a lot of questions. People are already, some of them are saying, we will not take the vaccines when it comes. From the news that some of them will say it will change the DNA, to those that say it will cause infertility, to those that say the side effects, people will die, and all sorts. So these are the information that are coming in, and from the interactions with them and explanation telling Nigerians that the vaccines that will be used in this country are safe, are effective. We have seen a lot of people beginning to key into it and accept with us that, yes, these vaccines are safe. And one other area I'm also seeing is that some states are already saying, oh, we are having information, the vaccine you are going to give us will not be enough, we will need enough. That means a lot of people are getting set to receive the vaccines. So we are seeing more of people who are shifting from, we will not take the vaccines, to those who are saying, we are going to take the vaccines. And the DJ NAFDAC, they say online, also have repeatedly also said and reassured Nigerians that no vaccine will be used in this country that has not been further evaluated and certified fit for use in Nigeria. So I want to use this opportunity to reassure Nigerians, those that are not yet convinced, tell them the vaccines, COVID-19 vaccines to be used in Nigeria are safe and effective. Thank you.
Dr. Opoze, we'll take a short break, and Professor Adeyeye, we'll take a short break now to take a few messages, and when we return, a number of other questions that will hopefully put people's minds at rest on this matter. Just stay with us. Thanks for staying with us. Professor Adeyeye, let me ask you, first of all, what are those challenges that you have seen, especially in the light of the information that came from NAFDAC last week, that the agency, or this week, that the agency has not approved any COVID-19 vaccines, and where you had to say out loud that you have not received any application from vaccine manufacturers, and therefore no vaccine had been approved by NAFDAC. What informed that?
Okay, is that question for me?
Yes, ma'am.
Oh, yes. What led to that is the fact that we now have fake vaccines in the market, online market. And knowing the fact that COVID vaccine is new, and there is no commodity, whether new or old, medical commodity, drugs, vaccines, medical devices. There is no commodity like that that can enter the country without the approval of NAFDAC. Let me tell you what happens at the beginning of the pandemic. There were so many people ordering testing kits. Sometimes they will say they want to donate to PTF, they want to donate to NCDC, they want to do this, but they didn't go through us. All testing kits are not equal. There are some that don't work at all. So we don't want the same thing to happen with COVID vaccine. First of all, they are limited in terms of the number of vaccines that have been approved, and no vaccine can be used without going through NAFDAC approval. That is what the regulatory agency in every country is supposed to do. So people started talking about, primary health is bringing 100,000 doses of vaccines. Yeah, there's nothing wrong in bringing 100,000 doses of vaccines. That is their primary job. However, that vaccine must pass through NAFDAC. We have to use scientific approach to ensure that the monitoring of it, the pharmacovigilance of it, once it is given to the patient, will be properly done. And Primary Health and NAFDAC and NCDC have been working on this for about maybe 2.5 months, 3 months, to ensure that we work together for the sake of our people. Because COVID vaccine is not ordinary vaccine. Even after the phase 3 clinical trials that were done, there are still things that even the manufacturer doesn't understand. Because what you give to 20,000, 25,000 people may reveal some things there, but when you give to the larger population, you may start seeing some other things. When you give to a different population, Black Africans, you may be seeing different things. That is one of the reasons why it is extremely important to let the public know that NAFDAC will do the due diligence to ensure that the vaccine is well evaluated before it is made available or before it is approved, and therefore it can be used after. So it is a matter of time. Some paperwork was not done well. So that is where we are right now, Primary Health and NAFDAC. And within a week or so, we should get that paperwork ready so that the manufacturer can then approach NAFDAC for the necessary submission and then review that will follow after.
Yeah, Prof, is NAFDAC doing anything about these people who you say are peddling these fake vaccines?
NAFDAC is doing a lot. Our investigation and enforcement directorate works round the clock. The federal task force is domiciled in NAFDAC. And the mandate of the federal task force is to go after fake medicines and unwholesome food. The federal task force is supposed to work with the state task forces. There are some state task forces that are active, some are not active. Nonetheless, NAFDAC still does its own job. Let me give you an example. We were in Asaba just before the pandemic late last year, and there were tetanus toxoid vaccines stored under 40 degrees centigrade temperature, 40 degrees, something that is supposed to be in the freezer. So these are vaccines that people are, I don't know, very likely fake, but at least it's labeled tetanus toxoid vaccine. But it may not be fake. People just handle them carelessly. So our work is already cut up for us. So we go after them, we seize the consignments, we prosecute, we fine, we destroy the product. So it is a 24/7 activity for us. So our investigation enforcement directorate does that 24/7. Thank you.
Is NAFDAC also interested in the storage state or condition of these vaccines when they get to Nigeria? Because it is one thing to bring them in their potent state. It's another thing for those vaccines to get to the areas, the localities where they will be dispensed to people. Is NAFDAC also doing anything about that to ensure compliance at the state levels?
Yes, we are. Part of what we do, our vaccine biologics lab, is to maintain the cold chain. And there are some packages that will actually have cold chain temperature indicators so that throughout the supply chain, that temperature must be maintained. If it is not maintained, there will be an indicator there to show that it is not maintained. Therefore, the quality might have been compromised. Primary health, let me talk about COVID vaccines first. Primary health is planning to have cold packs that will move the vaccines from one place to the other for the COVID vaccine. NAFDAC post-marketing directorate also will be monitoring the cold chain security or cold chain maintenance, so that when it moves from market to market or town to town, rather, that security is kept. And if it is not, it has to be pulled out of the supply chain. That is what the Post-Marketing Directorate of NAFDAC will be doing for the COVID vaccine. And that is why Primary Health and NAFDAC have been working together. As we speak, the two agencies are being trained by UK Medicine Regulatory Control Organization, MHRA. 40 members of our staff and 80 members of primary health being trained in pharmacovigilance. But so we have a lot in common and a lot of opportunities to work together. So both agencies will be monitoring the cold chain maintenance.
Health then. Dr. Opozen, these challenges is much talked about in Nigeria, especially when it comes to dispensing these vaccines in the proper state that they ought to be moved around. So what's the plan to ensure that the hopes are high? The president has said that the infrastructure of your agency is what is going to be used by government to dispense these vaccines to people all over the nation. So what is the plan? What do we have those equipment ready, or are we working towards getting them? What's the interface? Who is supposed to get all these, cold packs that DJ has spoken about, that will be used by your team to get across to the nation? Please tell us what's the plan.
Okay, thanks. And that is why I started by talking about the structure we have on ground, the technical working group. One of the subcommittees of that technical working group is the vaccine security and safety. Now, when we look at the vaccines that will come into Nigeria, these are vaccines, one, already pre-qualified by WHO, and our own NAFDAC will evaluate it also in Nigeria and for use in the country. Those processes are on. Once the vaccines are received from the airport to the national store where the vaccines will be kept until where it goes to the states, the National Logistic Working Team and the subcommittee of the Technical Working Group on COVID-19 introduction have done a lot of work already to ensure that these vaccines that are received will be stored safe, transported safe, and delivered safe to Nigerians. There are two groups of vaccines. For the mRNA vaccines like the Pfizer and Moderna, this requires ultra-cold chain equipment -20 to -70, 80 degrees centigrade. Most other non-mRNA vaccines will use the +2 to +8 degrees centigrade temperature. For those +2, for the mRNA vaccine, which is the first batch that when it comes in, pass through the NAFDAC evaluation, it will be stored at the ultra-cold chain equipment requirement. The National Logistic Team have worked hard to ensure that the ultra-cold chain equipment is installed at the national store. So there is enough readiness for that. And then also, the plan for these vaccines to be stored at the state safely and administered to our health workers have also been concluded. We even have instances of some states, I mentioned, for instance, Bauchi State, that are very informed us. They went out on their own to also buy the ultra-cold chain equipment. For these mRNA vaccines that needs the ultra-cold chain equipment, the -20 to -80, we have 100,000 doses of vaccine that will come in that will require that. The subsequent ones that are coming in, most probably most of those vaccines that will be considering based on the certification that will also pass through the NAFDAC evaluation, will be more of the +2 to +8 degrees centigrade. And for the +2 to +8 degrees centigrade is already established in all, we have that in all our health facilities that offers routine immunization in Nigeria. That is the temperature we store most of our vaccines, even at the health facilities that offer routine immunization. So that will not be a problem. And then even with the Pfizer, Moderna vaccines, at the point of usage, they can be stored at +2 to +8 for a maximum of 5 days for Pfizer and up to 30 days for Moderna. The arrangements on how this will be delivered to Nigerians in safe and effective, potent condition has been concluded. For instance, when the 100,000 doses is received, the strategy to be used to deliver this to the priority frontline health workers who are at the intensive units handling and treating cases is that at the state level, for instance, we're going to have 3 vaccination sites, and at each of the local government, 1 vaccination site, and each of these sites have up to 4 vaccination posts will be well spaced to obtain IPC. The structure that is set up in the strategy can take up to 1.2 million people administered using those sites. But we'll be looking at 50,000 health workers immunized using that capacity so that there's enough spacing, the IPC skills and protocols guidelines are well followed, and our health workers are administered. So at that point of administration, both the health workers and other Nigerians that are target group, the vaccines, the plans that the logistic working team is putting in place will ensure that from the point of receipt, storage, transportation to the site, and up to administration, the vaccines to be given to Nigerians will be at potent stage to give to Nigerians to stimulate immunity. Thank you.
Dr. Oposa, will these vaccines be sold to Nigerians?
Alero, just as our children are given vaccine free, all the routine immunizations, the COVID-19 vaccine will be given free to Nigerians. It will be given free. And there are a lot of efforts to ensure that when this vaccine comes in, accountability will be a watchword. In each of those sites, we have our security operatives, we have the health workers, the monitors from both the partners and government staff also being on guard to ensure that these vaccines are given free to Nigerians and they are not diverted.
But there is a question that came up, on my mind when Prof was talking the other time, Dr. Oposa, and that's the fact that they will test, of course. NAFDAC is going to test to be sure that the behavior of the vaccines in other climes it produces the same expected result in the bodies of Black Africans. So is there a plan for follow-up on people after the vaccine has been administered?
Yes. Now, once the vaccines are administered, it's starting from both the communication and the pharmacovigilance, like the DG NAFDAC mentioned. There's a lot of, during the training, the health workers, the epidemiologists, and everyone that is involved in this, and all the stakeholders involved in the pharmacovigilance, and as the DG mentioned currently, people are being trained on that, 80 from the agency and 40 from NAFDAC. And then the epidemiologists are being trained, and everyone. Once the vaccination is given, during the vaccination itself exercise, at each of those sites that I mentioned, there will be an active surveillance site ongoing there. And then will be a follow-up plan on what people should do during the point of vaccination. The people will be counseled, or if you have any feeling or fever or anything and you're worried, then you can also report back. So post-vaccination, there are also plans to ensure that Nigerians are followed up for any possible complaint that might come from them. But also just to mention also that the team is keenly watching on the countries that have started vaccination. For instance, the Pfizer is already being used in, for instance, the US, where about 60 million persons, or 6 million persons already vaccinated with it. We are following up with the trains and to see the minor things that comes up from there, which is common. Even like there are some people, they take ordinary paracetamol, they might have fever or headache or something else when it's supposed not to be the case. So the country and the plan that is ongoing and the training that is ongoing will ensure that even after the vaccination, we are following up with Nigerians. And just also to mention to Nigerians, we have 4 phases of introduction. The first phase, where this 100,000, once it passed the evaluation, will be administered to Nigerians, and there will be a second phase in Q2, a third phase in Q3, and a fourth phase in Q4. This is based majorly on the expected dates of arrivals of vaccines. And throughout this period, of course, from the phase 1 to the phase 2 and the phase 3, Nigerians will be able to also on their own speak loud and say, oh, okay, all the people took the vaccine, we can see it's accepted amongst us. And to reassure the team that we are aware of Nigerians, prominent Nigerians, so many who have traveled outside the country already to receive these vaccines. We have a lot of them. The communication team is already putting together a documentary on that, to show these people they have gone out, received these vaccines, they are back, and they are all safe. We promise Nigerians the vaccines to be used are safe, and there will be follow-ups for possibility, and to, at the end of it all, be able to give a full accountability report to Nigerians. These are how many Nigerians we immunized, and these were the findings after the vaccination, so that people would not be scared of receiving the vaccine in the next phases.
Yeah, just before we let you go, we know, and you need to educate us, that there is a distance between the first dose and the second dose. The word out there, some 30 days in some cases, in between, 45 days in between. If you can confirm that, what are they to do or not to do between the first dose and the second dose?
It's like every drug has its timing, how it should be taken. Likewise, vaccine. For instance, paracetamol, you say 8 hourly. Every 8 hours you repeat. For vaccines, for instance, pentavalent vaccine, the child is supposed to take 3 doses at intervals of 4 weeks. For the COVID-19 vaccines, based on the manufacturers, the instructions are also clear. For the Pfizer that will come in, the first 100,000 doses we are expecting, the guidelines from manufacturers for now for that particular vaccine is 21 days interval, where the first dose will be received and 21 days after the second dose will be received. So we will definitely, because after the first phase with the Pfizer, from the second phases and the third phases, the vaccines that will come in will not just be the Pfizer. There are other alternative vaccines, because the government targets to immunize 70% of Nigerians between this year and 2022, and that translates to about 149.6 million Nigerians. So we will have vaccines that are coming in from different companies that will pass through the NAFDAC test to be given to Nigerians. So the interval between the first and the second dose will depend on the manufacturer's instruction. And also to mention that already we know that the Johnson & Johnson is coming up with a vaccine that is 1 dose. So in such instance, the person will just receive 1 dose. So the minister, the ED, the DG NAFDAC, everyone is working to look at these other alternatives so that we fast-track the quantity of vaccines that come into Nigeria for Nigerians to be
almost
vaccinated.
Completely run out of time, Doctor. But just before we go, Prof, can you quickly tell us, how soon do we expect the rollout of these vaccines to the general public?
As soon as NAFDAC gets the dossier from the company, from the first company, Pfizer, it will not take us more than a week to review the dossier, because we will be relying on what others have done before, FDA, EMEA, European Medicine Agency, UK. So we use what is called reliance to expedite the review. And once that is done, we're going to also have another external body to quickly go over what we did in NAFDAC, the COVID vaccine committee. But all in all, it shouldn't take more than 7 working days. After that, the vaccines can come into the country.
Well, we have to thank you very much for your contributions this morning to the program. Professor Moji Adeyeye is the Director General of the National Agency for Food and Drug Administration and Control, as well as Dr. Basi Opozen, who is Director Disease Control and Immunization of the National Primary Healthcare Development Agency. Thank you so much for your time and thoughts this morning.
Thank you.
Thank you for inviting me.
Yeah, so we'll take a break, and when we return, more to come.
Welcome back and thank you for staying with us. Now, we'll just leave COVID alone for a while. We've talked COVID all day today, but we can never talk enough about COVID because people are not paying enough attention.
Sadly
And
so.
like the advice from the UN said, it is a matter of life and death. Your decision whether you should go out at all, who you should be with, all those are now matters of life and death. Please take those things seriously. Wear your mask, wash your hands, sanitize your hands, well, either wash or sanitize, whichever you prefer. And keep your distance.
And ensure to tell people to do the same. Because, I mean...
Right. Right. So we have COVIDed enough for one day, excuse my language. Now let us move to Ebonyi State. Let us find out exactly what's been happening in Ebonyi. And I'm going to start with the postings we have seen on social media regarding some not so pleasant goings on, some security situation, and we're fortunate enough to have with us the Commissioner of Information, Mr. Oji Uchendu Oji. Good morning.
Thank you.
Good to see
Charlie,
you.
thank you so very much, and happy New Year.
Oji?
Uchenna Oji.
Yes. Oji Uchenna Oji. Thank you very much for coming this morning.
Thank you.
So let's start. We know that plenty of things have been happening in Ebonyi, but the one that's been in the news lately is a security situation. And the post, on social media is that Ebonyi State is having some issues with some herdsmen. How true is that?
Yeah, not at all for me and for Ebonyi State government. That is the only blackmail enemies of progress can go with. When that social media post came, reactions were made, one from the state government, one from the security agencies, and one from the National Association of, that is the MACBA, the Mietiala national body. And the reaction is that this is most unfounded, mendacious, just, fabricated to just paint the state government black. We have got no issue about chasing away Fulani herdsmen who are in Ebonyi State on their normal business. Mind you, over the years, even before the creation of Ebonyi State in 1996, we've had Fulani herdsmen, the normal persons, coming to do business in parts of Ebonyi State. Just like you have people of Ebonyi State and indeed Southeast going to do business in Lagos, in far north, far west. And so for us, it is just a mere distraction that has no capacity to really distract us. We are really focused. Our dear governor is focused. It's a bridge of unity. He believes in one Nigeria, in unity of purpose. We are living peacefully with the herdsmen who are in Ebonyi State. And we have several structures at the community level, local government level, and state level that does interface, or structures that interface with the herdsmen from time to time. At the state level, it is headed by the Honorable Attorney General of the state, where there are issues of misunderstandings, conflicts, crimes, they will be sorted out. We have existing laws which we made for the purpose of ensuring peaceful coexistence among one another. But I give it to the enemies. The only thing they can hold is the blackmail that we are maybe have not been with herdsmen, or we are chasing them away.
Okay, so
no more, no less.
Well, you know that saying, I don't even know the origin of it, that is African or not, that there is no smoke without fire. So what really happened? What gave rise to this, what you call this blackmail in the first place?
Yeah, what gave rise to it is that bid to look for nothing, to tarnish the image of a performing government.
Are you saying that story is not true? That nothing happened in that guise at all?
Yeah, in the case of the latest social media post of allegedly a herdsman that was being chased away by the people of Ebonyi State, it is not in existence. What happened was that a herdsman who had stayed peacefully with the people of Ebonyi State had a reason to travel. He got a chieftaincy title in their place. I've forgotten the name of the state. And he had a reason out of the calling of his people to go back. And one mischief maker who actually might be hide under the cloak of political party, coloration, went to do, a speech behind that, an audio to say, we are chasing this man away. The voice, we couldn't see the person. The voice, of course, you see that it is a voice of a tout who was really, for pecuniary reasons,
How do touts sound?
drafted to do this. And, of course, the security agencies immediately swung into action, got the issues, chided them. The national body, particularly the national secretary, who is also my friend, also had to chide them that this is most unfounded, mendaciously fabricated, just to give false impression. But they should know that the governor is not losing focus. His mind's eyes are on the ball on how to make Ebonyi the hub, economic hub of the Southeast. And the tempo is high. We're already cruising. So if I tell you about Ebonyi State, you will not appreciate the dimensions until you come to Ebonyi State. When you come, you will see that the testimony is just fantastic.
Well, the last time you were here, you told us plenty about it.
Ready to tell you more?
Yeah, so we've been talking a lot about COVID on the program today. So let me ask you, how is your government dealing with COVID in your state? Are people adhering to the safety protocols as recommended, the non-pharmaceutical ones, of course, the ones recommended by NCDC?
Yes, as you do know, COVID came to Nigeria, I think, in February. In March, every state was going to get a hit, so the governor had to take the bull by the horn by convening a Security Council meeting and rolling out a lot of regulations on how to tackle the menace of COVID-19. But to summarize the whole exercise in the first wave of COVID-19, the governor had to establish what is called Center of Excellence for COVID-19 treatment. And that is the first in the Southeast. Of course, we had virology center, so he had to convert it. It was not difficult for him to convert. Now, apart from that, the governor had to establish what we call observation centers in each of the 13 local government areas we have to observe suspicious cases and to make for accessibility and nearness. Now, the governor also had to establish isolation centers in each of the 3 zones, including the one at the capital city. When there is a case that is observed that appears to be, by all indications, that person or the suspect will now be taken to these isolation centers. And that was what we did. And of course, the governor had to furnish them. Of course, the governor immediately started building for Alex Ekweme Federal Teaching Hospital, a complex that is the best single hospital complex in Nigeria. They came from Abuja, they confirmed it. I'm not exaggerating. And this complex is 400 seating capacity bed with a lot of facilities. The governor just handed over to FETA, and part of the function will be to address issues of COVID-19. Now, in the second wave came. The governor also had to really call stakeholders to address them, and structures were further reactivated. And of course, we have law, coronavirus and related matters, where the governor is empowered to make regulations, which once he does make it, it becomes a law and binding that must be enforced. And so, but as it is, we emphasize more on precautionary measures. We don't emphasize more on lockdown, as it were, because of the adverse economic impact or implication of locking down completely. And so this sensitization, a committee has been set up, of course, community, local government, state level, to go to the people and begin to tell them about the implication, of course, to also let them know that we have facilities that they can really take advantage of to sort out issues of COVID-19.
Honorable Commissioner, is how are the people reacting? How are they responding to the advisories, the safety protocols that have been recommended at the federal level and that are supposed to be activated and actioned at the state level? How are the people receiving all of the communication that you're sending out? How are they reacting? How are they taking it all on board?
Are they all wearing masks?
Yes, if I don't tell you what we have done, you will not appreciate the reaction very well. If I tell you the reaction is positive, you will not appreciate until I lay the foundation. So it's the foundation that I have laid. So what is the reaction of the people? I can say so far, so good. It is not too poor. What we have done is to use our room, our radio room, which we call situation room, to really, on daily basis, through jingles, announcements, sensitization programs, advocacies, let the people know. And the reaction has been very positive. But of course, it cannot be 100%. Some people still do not believe that COVID-19 is a reality. One of the problems is the effect or the impact of social media to the society. Of course, ignorance is also one of the issues. But I can tell you that so far we have a minimal case of fatality, we have a minimal case of active COVID-19. Okay, so it goes to show by that there is high response to the regulations or compliance with the regulations on COVID-19.
Now, another challenge that a number of people would look at now is, okay, so this is the second wave, and we're already considering getting vaccines and all of that. The federal government has talked about the fact that it is the responsibility of the states to provide the storage capacities and all those things. What's the plan of the Ebonyi state government to provide that cold chain facilities that will be used to ensure that the integrity of those medications remain?
Yeah, even though health is in the concurrent list, our governor does believe that whatever policies and programs he does make in Ebonyi State should not for any reason be inconsistent with that of the federal government, talking about the Presidential Task Force. And so we have always collaborated completely and comprehensively. Now, I did tell you that the governor did establish COVID-19 centers, including isolation center, treatment center, observation center. And the governor also does, from time to time, procure some of these medical facilities, including hand sanitizers, face masks, and all of them. And the idea of the governor is that government needs to really throw its weight in ensuring that the people have access to some of these facilities. Churches, that is worship centers, markets, commercial activities going on, that the people within such places should have access, at least on a minimum basis, to the facilities that will help them be safe from the scourge of COVID-19.
No, I'm talking about the storage capacity, storage facilities for the vaccines when they come.
Yeah, I also told you that we have COVID-19 centers, and these centers are very comprehensive in their content. So we have storage facilities, even though I'm not a commissioner for health, as to know all the technical languages. But the center is such that we have a storage, room. We have so many facilities within the place. And so the governor is actually prepared, so much prepared. Of course, don't forget, the Presidential Task Force gave him an award as ambassador, COVID-19 Ambassador of the Year, given his role in ensuring the protection and the safety of the people of Ebonyi State from the scourge of COVID-19.
Okay, interestingly, Honorable Commissioner, even though Alera said we have talked enough about COVID all day, but then it's really a matter of life and death, as the United Nations has made known. How significantly, how severely did the COVID-19, has COVID-19 affected lives and livelihood in Ebonyi State?
Yeah, like I did say, even though I don't have the details, the first wave, second wave, first wave was very minimal. Ebonyi State case was not as hard as other states. brought about by the preparedness, the proactiveness of the governor, and the fact that he did establish some facilities. And of course, the sensitization process, a comprehensive structure we have on ground to really help to move to get some of these things done. Then in the second wave, I also know that the case is very minimal because we watch it on the screen. We also liaise with the Minister of Health. And the fatality, of course, is minimum, extremely minimal compared to other states.
Okay, let's look at the economy of Ebonyi State. There's no doubt COVID-19 hit the whole world, not just Nigeria, hit the whole world. But let's say we're all trying to get a grip now and move on as best we can in the circumstances. What is the case with Ebonyi State? How hard hit were you by the pandemic, and how are you coping with it?
As a matter of fact, COVID-19 actually did impact on the economy, socio-economic activities of the state in the first wave. And of course, in the second wave, understandably, we didn't lock down completely. And so it wouldn't be as hard as that of the first wave. But what the governor did was to really look at the budget we have to increase the funding for health, especially COVID-19. And in the 2021 budget, which has been passed and signed as a law by the governor prioritizes health, especially the funding of COVID-19. And of course, human capital development, education. These are the three key priority sectors, three major key. And the idea of the governor is that in the wake of this COVID-19, with this attendant economic crisis, that we need to do something differently to look at the health of the people of Ebonyi State. So what did they do? The governor continued the construction of a college of medicine that will be the biggest in Africa. Whatever I say, you go and investigate it. Now, this college of medicine, we have a dialysis center, the only in Africa. This dialysis center, you cannot find it anywhere in Nigeria, in Africa. It's going to be the only one. Now, if you see this complex, it's just a world-class complex. Now, it is set to handle issues of terminal diseases, including liver problems, heart problems, lung problems, even blood problems. And a lot of money has been injected. Of course, part of the system will also handle some emergency cases of COVID-19. And now, apart from that, the governor also had to really put in place the primary health care facilities. In each of the ward, we have effectively functioning primary health care facilities. The idea of the governor is that if there is any case, whether a health matter or whatsoever, somebody should have to take care of the patient and take the person straight to the primary health care facilities we have. And in some cases, the person can be taken to the secondary healthcare facility. Now, that's why the governor also had to ensure the functioning of the secondary healthcare facilities. Every local government has a general hospital. In some cases, constructed by the governor. In other cases, furnished by the governor. And they are working. Some of them are also part of the centers for COVID-19 Center of Excellence. And now the governor is also doing a lot in the area of tertiary healthcare delivery. Like I did tell you, we have a virology center that the governor came upon coming. He now built immediately to tackle issue of viral Lassa fever. And now the governor also had to build what is called College or School of Nursing and Midwifery. The idea of the governor is that the capacity of nurses must be raised. The capacity of midwives must be raised, not only within Ebonyi State, but even outside the shores of the state, they can come and have capacity. Don't forget, the governor attracted a military hospital, a referral hospital, which is going to be the biggest in the southeast military hospital. And these are the medical facilities or health facilities that will help to attend to issues of health. Of course, COVID-19 inclusive. This is what the governor has done in the area of health. Now, in order to further ensure that this scourge does not affect the economy of the state, the governor had to continue the construction of a shopping mall that will be the biggest shopping mall in Africa, it sounds incredibly laughable. But in Africa, if you appreciate the credibility of Mr. Bruce, the owner of Silverbed, he confirmed, he said he has traveled far and wide, that he has never seen a mall as big as this, having about 6,000 modern shops.
Is it ready now?
It is about 95% completion. How I wish the visual is on, you would have seen it. And I can tell you that this shopping mall is for the enhancement of the economy of the state. Now, we have an international market where marketers that used to stay in slums in the name of market have been relocated to a world-class international market. This international market is biggest.
What's this market called?
International market. It is located along the Trans-Sahara Highway, linking towards Cross River. Towards Cameroon from Cross River.
In what state? I'm sorry, in what city?
In the capital city of Ebonyi State, Abakaliki.
Okay.
Oh, I may have to describe the international market. As you are entering Ebonyi State from Enugu, you'll fly through 6 good flyovers before you link, a straight road, before you link to that Trans-Sahara Highway. You get the market by the left. And once the bridge linking to between Cameroon and Cross River is done, that's an African road anyway, you can see that it is fully an international market. Now, what am I saying? These are economic facilities the governor is building. Do you know the governor is building an international airport that is fashioned after Lagos and Abuja in terms of size? It's sitting on 4 by 4 kilometer land and 3.5 kilometer tarmac or runway, which by all indications is one of the biggest, 3 biggest in Nigeria. These are economic facilities the governor is building. Now, the governor is also mindful of the need for investors to have Ebonyi as a safe haven. So that, because private sector investment has a lot to do with the enhancement of economy of any given society. And so the governor decided to beautify the metropolis, the satellite towns, the rural communities. What did he do? He had to make Ebonyi State a global village through creation of network of road. Every local government has 25-kilometer road, minimum. And this was done, and it's being done in concrete pavement. I'm sure you have not seen concrete pavement. The one that Dangote is doing in Lagos. Ebonyi State government is the first government in the history of Nigeria to start it. That is because the governor, on going to US, saw this concept. As an engineer, a passionate engineer, he had to introduce it. Now, that pavement is to last for 50 years. Now, we have a total of no less than 800-kilometer road done by the governor, federal government road. Now he's dualizing, whether you're coming from Enugu to Ebonyi, Abia to Ebonyi, Cross River to Ebonyi, Benue to Ebonyi. You are going to cruise in a wonderful road as if you're on air. And this road is being dualized by the governor.
Okay.
Now, what did the governor do? The governor had to link up these chains of roads, especially the major junctions, with wonderful, strong, virile flyovers. That's a beauty to behold. If you go there in the evening, wow, you say, am I in
What would be
Dubai?
interesting, Honorable Commissioner, in all of this is how does this impact on the ease of doing business?
Fantastic.
In Ebonyi State.
Fantastic.
Because it's about lives, yes, but it's more about livelihoods now because you need good livelihoods to stay alive. So how do all these impact on ease of doing business, especially government agencies in Ebonyi?
Yeah.
By the way, before you answer that question, is the market ready?
The market is ready.
The international market?
It's being used now.
It's being used, okay.
Yeah.
All right.
How does it impact on the livelihood of the people? The governor does believe that economic development is all there is for a place to develop. He does emphasize and differentiate between economic growth and economic development. Yes, you can be a rich nation, which is actually the bane in Nigeria. You can be a rich nation, yet the human persons are not having something on their table. They are not self-reliant. They are not self-sufficient. There is no food security. So what has the governor done to actualize this? With all these environments curated and economic facilities curated, the governor is pumping or funding the issue of human capital development to drive the environment. What did he do? In the area of education, he had to really establish what is called vocational college that's aimed at harvesting our technicians, those villagers, street, technicians, artisans and craftsmen. And they are given scholarship to go into vocational college for a period of not less than 2 years or no more than 4 years to get certification and more knowledge, skills to develop themselves. And after that, the government does empower them. So they will use this environment, they will occupy these economic facilities, and they will have the wherewithal, the mental empowerment to drive the environment they are. Now, again, we have what is called King Davis Academy, which is actually aimed at harvesting the best brains. Those children in primary school, at the end of their primary school, they are going to secondary school. We look for the best 5 who are taking on examination dispassionately, and they are selected, whether you are a son or a daughter of a governor or the poorest person in the society. Once you pass, you are given scholarship. You undergo this King Davis Academy, and you are, as a gifted child, you are given scholarship. You are given all the attention, clothing, even holidays will be borne by the government. That is to raise the human capital. Now, let me go straight to empowerment, because after creation of this environment, the governor thinks that people should be empowered to have their destiny. So the governor decided to be empowering people. In fact, the NSAS program, came, and the governor had to roll out 3 billion. That one is going on now for every person, all categories of people, whether those that participated in the protest or those that are in the house, because we're all casualties of NSAS. So you have opportunity, whether you're a civil servant or a journalist, to access the 3 billion. Can be 500,000, 1 million and above, depending on your business plan. That is going on. Again, the governor had to also look at civil servants. Say, yes, you need a second address. Yes, the white-collar job they pay is too small.
How many people have benefited from this 3 billion naira you talked about?
The process is ongoing. That's what I said.
Yeah, I know, but how many so far? How many?
So far, applicants should be more than, I wouldn't say for sure, but as at the last time I met with the SA on SME, it was going to up to 2,000 number of people that applied. But I'm sure that was in November, December when I asked him.
So the money they haven't begun to receive the money yet?
As I speak with you, they are being processed to part of evaluation and assessment to go into trading. I think the SME said it's going to be by visual training in assessment because of COVID-19, because their number is so much. So in a short while, this NSAS empowerment scheme, the funding will commence. Now,
so these are the infrastructural developments you're talking about?
Just the smallest, the minutest of them. Now, I want to say that the governor also looked at civil servants and felt they should also benefit from the empowerment program. So the governor gave them a facility, a loan of 4 billion. That was three years ago, last year. And this 4 billion, they have assessed it. Now, this is different from other empowerment programs. 2 years ago, I was commissioner for human capital development. The governor gave 750 million naira for the empowerment of 3,000 number youths, 250,000 each. I came to Lagos here. I rolled out on behalf of the governor 130 million naira after training 520 Ebonians who were in the street hawking. We called that scheme Street to Skill Empowerment Program, and they were giving 130 million. And so, what am I saying?
Mr. Haji, we need to wind down now. So very quickly, how serious is that problem we used to hear about, I'm choosing my words advisedly, in the Southeast about the boy child not wanting to go to school? He prefers to be a trader, so he prefers to be mentored from when he's young, so that by the time he's 20, 21, he's already set up in business.
Yeah, it was one of the problems of the state. We had inferiority complex arising from where we were coming from, totally criminally neglected.
Is this still a problem?
Yeah, that's what I'm saying.
It
was a problem. It's not a problem now. What did the governor do? The governor had to take the bull by the horn. He introduced what is called an out-of-school children program that is aimed at getting compulsorily anybody that is seeing a child of school age that is seen outside the school, get them to school, give them counseling,
Thank you,
give
Mr.
them
Haji.
free education, And of course, compulsory.
Thank you.
Okay.
Thank you, Mr. Oji Uchendu, Oji Commissioner for Information, Ebonyi State. You were well picked for your job, I must say. Thank you very much for coming.
Thank you, ma'am.
Thank you for staying with us. Sunrise will return after this break for the home stretch. Stay with us.
How do I start, Lero? How do I start?
Start from the beginning. That's a good place to start, isn't it?
Well, you know, the character, that character. You know, when you are anchor of a show, you can say anything, right? Especially when the person has...
It's your time.
Yes, thank you.
Go on. Go on. Deal with him.
That character was one of the people that I had to interface with when I started broadcasting in 91. Himself, the German Anikulakbos of this world, the Bayoloa case of this world, the Tokumbo Debumis of this world. There's another... The word that almost came from my mouth was criminal. Another one of them, but along the line,
I didn't hear anything.
You didn't hear anything. That's fine. You know, the Lagbajas of this world and the rest of them. But this character, you are just about to meet him now. He's an all-round creative comedian, actor, broadcaster, play director, and instructively, a theater arts lecturer at the University of Lagos. He is known to be among the pioneers of modern solo performance in Nigeria. Anyway, he'll talk more about that as we go on. Could call him a veteran in the creative space. His name is Tunji Shotimiri. Good morning and thank you for joining us.
A very good morning to you.
Is that pronounced?
Auntie Alero. No,
Yes. Pile it on.
No. Let's give honor to whom honor is due.
You are not on a solo show right now, my dear. You are our guest.
No, hear me. You see?
Yes, come on.
You see?
Yes.
Enita balaba, only baba. At this point in time, Enita balaba, only mama. I am meeting you here. I'm your guest. Yes. You are my host. And I have to pay obeisance.
Very correct.
Honestly.
Very correct.
Excuse me, this is not ABBA.
Oh, sorry.
This is not ABBA.
Don't be,
this is studio.
Okay, a bar of channels.
Did he get the pronunciation of your name right?
Yeah, he got it. Okay. He worked. No. Makinde is initiated.
It's one of your boys.
No, he's already initiated. So he has this in his veins. He knows.
Initiated
what does
into
the
what?
name mean, by the way?
Not into cult. Initiated.
You know you are a lecturer.
Into professionalism.
Yeah,
cult of progressive. If a showinka could be and accept to embrace a cult that is progressive, then who is Shotimiri?
Correct. Please, what is the meaning of Shotimiri? Let's start from there.
Thank you. Oshotimiri, that's the full pronunciation. Oshotimiri, meaning that the wizard waxes stronger. Let's put it literally.
Okay.
Wizard waxes stronger. It means that the wizards are there to give me full support, propelling me to progress, to prosperity, to achieving successes, in life.
The wizards have been busy.
The wizards have been busy.
So why did you put a question mark behind the name at some point?
Bless you. That question mark is to engender this kind of question. Is to draw attention to people. That question mark. All over the world, people ask me, and I feel so important when they ask me. No, serious. So that's just it. My family, they've adopted that question mark, and they feel so comfortable with it. So who am I? Abi?
It still doesn't answer my question.
Why did I put the question mark?
Yes.
He put it there
I just told you it's to create...
To arouse interest.
To create all kinds of commotion, awareness, confusion.
to draw attention to this very tall, handsome, fair in complexion
yes,
guy.
very.
You're asking me now.
Very
I'm feeling
fair
important.
complexion and very
Yeah, I
tall.
mean,
Very tall.
Yeah.
thank you. Very tall.
Very tall.
Got
Yeah.
presence.
Yeah, I mean, personal talk.
Burning.
Personal talk. A huge presence.
We can see that you needed to enhance the height, you know.
No. See what people say.
Meanwhile, he's looking like a chef.
Oh my God, that chef thing. Yeah, see, when Amosun, the former governor of Ogun State, met me, and they would say, I said, sir, this cap came into being before your regime. So you actually adopted my cap. Amosun, give me credit. Yeah, I told him, give me credit. And he did.
Well, he doesn't wear white, so he doesn't look like a chef.
Once in a while, you wouldn't know where there are programs that Amonso is invited to, and he has to adorn the white. He's a member of our cult again. Cult. And he's from Ogun State. Abi?
So
The
are you
Ogun people
cults,
now. We know ourselves, so. No, let me put that song in a very jazzy manner. You know, soprano. Let her go. When I say what, you say what? You say oh. You are messing up. You don't even know. Listen, there is what
We have a guest on our hands.
I didn't know that you were also into choral performance. I thought you were into solo performance.
Ayo, let me tell you. Have you heard of Professor Akiuba?
Yes.
The man who,
I remember him.
yeah, of Elekoto music is passed on now. Baba me, God bless you wherever you are. I was one of the founding members of Elekoto group that the people that actually pioneered cultural music at Lagos television those days. Now, what we were doing with Jumoke Fashola, Stella Monye, the Bright Chimeze and the rest of them who came to join us in Unilag, Center for Cultural Studies, we were doing cultural music in a choral manner. So Akiuba was someone who, a deep intellectual, he embraced cultural music and he promoted it through in theory and practice. Let me put it that way. So remember his song, the Christian song.
From the album Black
Yeah,
Bethlehem.
oh my God, you remember that one? Kérésìmesì tún máa dé o, ẹ̀yin ènìyàn, ẹ̀yọ̀, ẹ fijó sí i o, ẹ fijó sí, ẹ̀yọ̀, ẹ bẹ̀rẹ̀, ẹ fijó sí i. You see, it's not. This is cultural music, taking it beyond the realm of the African environment, so the people all over the world will appreciate the identity of the African people.
Okay, now let's talk about your specialty, which is the solo performance.
God bless you.
First of all, explain what it means. We've seen what you have done. Is it the same thing as what John Chukwu did as a comedian back in time, and a number of other people like that? Is that what you mean by the solo performance? What comedians do now?
I like that mention of John Chukwu. We grew up to know CJ, John Chukwu. And we followed his art till he passed on. Now, John Chukwu, Bisiola Tilo, at the late Atalade, and the rest of all, in that group, what they did was to inject humor into presentations that they, were asked to do. It wasn't as if they prepared a full solo, they made any preparation for any solo performance. So what the difference between that generation and Tunji Shotimiri is the fact that I deliberately created a platform, a forum for solo performance. And I did it for like 1 hour plus, inviting people to come and see me doing different characters. And that's the difference. And the people must know. So when I say Tunji Shotimere is the pioneer of solo performance and stand-up comedy, I deliberately, it is deliberate. So there is no argument about it. I created a platform for it, for the world, to come and see a new art form from a Nigerian environment. God bless the soul of Uncle Yinka Craig. I told him I wanted to do solo performance, stand-up comedy, solo performance / stand-up comedy in this country. And he said, Tunji, that would be great. Guess who sponsored that? The Goethe Institute, German Cultural Center. It was a new art form in Nigeria.
And when was this?
That was in 87, thereabout, 88, thereabout. Now, I tested that, that performance at different fora, Alpha Communications, where you had people like Shegun Odegbami, Bisola Tilo, and all of them. Everybody was wondering, what is this? Even at late past Steve Rhodes' annual program, Steve Rhodes' Voices, Papa invited me and said, Tunji, I heard you, okay, come and do it. And he was marveled, and he gave me a recommendation. I have the letter. Nobody had seen that sort of thing before. Yes. And he gave me a commendation to say, this is unique. I have the letter. So people, you see, this platform is we need to resolve all of that confusion, because out there, even the students that I have taught, some of them still feel that because they are out there performing, they get so confused. Because they don't have the benefit of history. And we need to correct it. Now, people have published so many materials about this. So anybody, and I have all of these things documented. So what are we talking about, Ayo?
What are we talking about, Ayo?
We're talking about solo performance.
Brilliant, Ayo.
Now, you drew a difference between solo performance and stand-up comedy.
That's right.
What's the difference?
The difference.
I thought that a comedian standing, performing stand-up comedy was a solo performer.
Yeah, you could. It's quite possible that you merge the two, Ayo. I'm saying that within the performance of a solo art, you can have comedy injected into it. And Tunji Shotimere has been able to combine comedy expressed very profoundly in his solo art. So it is a combination of the art of comedy in the presentation of solo performance.
So it's more than just comedy.
That's it. It's more than just comedy.
And it doesn't have to be comedy.
Oh my God, oh, you're so sweet. This is why Alero is beautiful.
Oh, really?
You see,
without that, she's not beautiful?
No.
I take exception to that, please. We could actually slug it out right here.
You see, he's now doing solo performance. He wants to take solo performance to impress Alero.
Please. Oh yeah, dig it.
No, he's wearing white.
So I'll go with the winner.
But let's. It's interesting, where we are now.
No,
in
2
terms
hours
of
is not enough for us on this show, but it's okay.
Entertainment. Oh, we have a break.
You'll manage.
Yes.
You'll manage.
I think we need to take a short break.
Okay.
This performance is by the director, so let's go take his own performance. Well, Tunji Shotimere is still with us here. Well, the Shotimere is with a question mark. That's what he has made clear. A very, very quick, because we really don't have much time now. Very, very quickly, what's your assessment of where we are in entertainment today? And I'm not just talking about the pockets of it. If you look at it globally, where we are coming from, where we are, and what we should do to make sure we do not retrogress.
Fine. I want to say that entertainment has moved beyond what we used to have in the 60s, 70s, and 80s, and all the rest. Because of the intervention of social media, technology. The new technology and all of that. So that we're able to reach out to a wider, population. And even in terms of managing, of administering, of marketing, entertainment, we are doing well, I must say. But then the point that we need to note, areas where we need to improve upon, I want to say that professionalism is something that we are relegating to the background because of the social media, because anybody can post anything. Nobody is, supervising, as it were, what you do. Even in broadcasting, you find all kinds of people coming on air to, just take the liberty, take liberty for stadium.
Miss Kelenos?
Yeah, they take liberty for stadium.
For stadium?
Yeah, they just take liberty for stadium.
It is a stadium.
I'm telling you, like that. So the point I'm making is that we need
a stadium.
to check ourselves, because for now it's social media syndrome.
But just to be clear,
yeah,
it's taking liberty for license. So, because some students are resuming in January, next Monday.
Oh, okay, sorry. I'm sorry. Okay, but Ayo is correcting me.
Having said what you said, I think you should also factor in that entertainment in those days was not taken as a profession. Most of the guys who were in it had day jobs.
That's right.
And they entertained in the evenings. But now, being an actor, being a musician,
it's serious business.
It's a serious matter.
Yeah.
I mean, it's your profession.
That's right.
And you go after it. So there's money to be made now, which wasn't there in those days.
It wasn't there. And like I was saying that, you now reach out to wider, viewership, audience, and all of that. But then, the marketing, those who trained us didn't teach us how to market
Make money.
our product. Yeah, that's it. Because we were just doing
trained
it.
just to entertain.
Yeah, so come and act. And we were happy doing it.
Yes.
But then we have to pay bills. So we're now trying to adapt. You see, we're talking about manager. Every time I call some of my students who are now doing well, I thank God for them. They say, sometimes they don't even pick their calls. I get so angry. Yeah, and I was asking some people, they say, it's their management, so you can't just call them like that anyhow. But I find something very wrong with that kind of arrangement. I mean, you can't call them, but when they need reference letters to go and do postgraduate studies in Canada, they will now be quick to call. If I say, you students, listen, call my manager. So that's something we need to resolve.
Okay. Well, we are running out of time.
I mean, there can't be enough time to talk to Tunji. But we just have to
But my
wind it
Konkere
down
music,
today.
they are not playing that Konkere music.
Konkere music.
I have a musical presentation that the world has looked at, and they're saying...
But you didn't just create it. It's been on.
It's been on, but this one we have, it's now a repackaged, a reloaded one with Yinka Davids.
But don't worry, I'm pretty sure that on sign out is what we're going to play.
They'll play that bit.
Yes.
Thank you very much.
Having a lot of politicians. He himself has now
one.
He's a politician. Oh my gosh, I know. Do they understand? Do they people can? If
Please,
the
you better sign
leaf
him out.
stays too long on the soap, it will become soap. No,
Thank you very
So
much.
you will be washing with soap.
but it is not soap here. We have to be careful. It is not soap here.
Thank you very much for coming.
I appreciate you. I appreciate you, my mother. I appreciate you.
We had a
My
wonderful
mother, Iyalaje, you will live long. A youth, you will live long too.
Please, the name is.
We have to draw the curtain of today's program.
Okay, Ayo Makinde, don't be angry. Ayo Makinde, if that will bring.
Thank you very much for being with us. I'm Alero. Wishing you a very happy weekend indeed.
Have a wonderful, wonderful weekend.
Bye-bye.